Harvard Health Centre, Sally speaking.
My stomach swells up and then the blood just kind of gushes out at me.
I think I'd rather stay alive a little longer.
Yeah, we'd all like to stay alive a bit longer, yeah.
Yes.
We had a bad relationship.
Okay.
I don't trust, to be honest, I don't trust in love.
It's like a burning sensation, like someone's put like a cigarette out in the middle of my ear canal.
Okay.
And I just don't know what it is. Feels like my eardrums or something's about to just explode or something.
We have to say this because you understand that obviously it's a potential squamous cell cancer.
Yeah.
Too cold. Ugh, nasty. Good morning, Harvard Health Centre. How can I help?
Louise Horton. Hi, Louise. Hello there. Do come on. OK, do come in. All right, I'm Dr. Cordell.
Hello.
You normally see Dr. Lee, don't you? Is that right? Yeah.
Yes. Yeah. I have like really sore skin, just hair on my breast. It looks almost like it's really dry skin. I spoke to someone, like 111 or whatever it is, and they asked if it hurt, and I said, I don't know, because I have no feeling along there after my breast reduction.
OK.
And it's getting bigger, so I'm obviously just a little...
The area of soreness is getting
so I'm a
bigger.
little bit concerned.
Well, we should check it out,
Yes.
shouldn't we? I'll have a look, OK.
OK.
Do you want a nurse to come in while I have a look?
No.
No?
As
OK,
I said to the receptionist,
Pop
once
up
you've...
behind the curtain here, then.
Lovely.
You just remove what you need to remove
OK.
to see the area. And you've not had rashes or sore patches there before?
No, I had a really bad infection after I had my breast reduction.
So, this is the patch?
Yes.
OK.
Hello, come and have a seat. I'm Dr. Barnard.
Hello.
Oh, thanks, Callum.
What can I help you with?
Callum has been going over on his ankles.
Yes.
Now, I thought it'd be something that would probably rectify itself, but last year his school shoes kind of kept on getting wrecked because his ankles were going over, so...
OK, yes.
His teacher at school, kind of at the end of the year, said, oh, I think you should get them checked out.
How long's it been a problem for?
You could start seeing it a couple of years ago, couldn't you?
Yeah, it's not something that you would jump up and look at him and go, oh, he's got really bad ankles.
So you're not sort of turning over on your ankle, like you're currently twisting it or anything?
Not twisting, it's just literally a posture thing.
Well, I did twist it once and sprained it.
Yeah. And then I kind of noticed that actually everything's turning in a bit, and then he says he's getting pains in his legs, intermittent pains.
Yeah, I was going to ask, you getting any pains in your knees or anything?
Sometimes, yeah.
Yeah, OK. Do you want to pop your shoes and socks off then and we'll have a little look at your feet? OK, and stand up for me. And just go up onto tiptoes for me. Yeah, OK, and back down again. OK, and sit down again for me. It's got very flat feet, haven't you?
Yeah, I think.
Yeah. Does it run in the family at all?
Yeah, we've got hobbit feet.
Yeah.
Well, I've got hobbit feet. I just don't want it to affect him kind of with his running.
So it's really common, flat feet, especially in this age group. We've got quite flexible feet. And generally what you need is insoles in to give you that support to your arch so that you're holding... So you see, when you stand up, because your arch just collapses, your ankle rolls in.
Yeah.
Whereas if you've got the support in there, it comes up to a more natural position and then it's all straight again. So that's what you need. But it'll probably be orthotics at the hospital to make some insoles.
So will that, if he has insoles, do you think that will rectify itself, or...?
It doesn't sort of change the underlying foot, but it just puts the foot in a normal position.
Okay.
So people with really flat feet will find that they need to wear them all the time, and they just put them into their shoes.
Okay.
Yeah.
I say that wasn't too bad, was it?
The skin feels a little bit thickened, doesn't it, actually?
And it started off as big as my fingernail, and it's then just got bigger.
It's got
I would
bigger.
say maybe
and
3 weeks.
Yeah, it's a bit
So
bigger than a penny, isn't it?
Yeah.
Now, really, in size. And it's got this sort of little bit off the side. Looks a bit like Australia, doesn't it? Dress yourself up. We'll have a chat about what to do about that. OK. Sometimes we take pictures of these funny rashes when we're not sure what they are, but I'll remember yours because it looks so much like Australia.
Well, I've never been there, so it's nice for Australia to come to me.
Yeah, it is, isn't it? OK, come round when you're ready and we'll chat about that. OK. So, first question, is that anything serious or sinister? It doesn't look like it. So I think that's most likely some form of dermatitis, OK?
Oh, OK.
It could just be a type of fungal infection. That's the other possibility.
That sounds beautiful.
Yeah. And if it's not one of those two, we will get a specialist assessment. Now, I think actually we will treat you for a fungal infection first, because if we treat for dermatitis and we're wrong and it's a fungal infection, we can make it worse. So I'm going to give you 2 weeks of antifungal cream.
OK.
OK, to use. At the end of that 2 weeks, if it hasn't gone away, I'd like you to go on to a steroid cream, which is what we use for dermatitis. OK, and do that for 2 weeks.
OK.
OK, if at the end of those 2 weeks it hasn't gone away, then we will get advice from a dermatologist, a skin specialist, OK?
Yeah.
OK, if we're not winning, it is important that we go on and get a specialist opinion. So, OK?
Yes.
There we go.
Lovely, thank you. Handbag and cardigan. There we go.
You got everything? Done good?
Yes, thank you.
OK. Bye-bye.
Bye.
And that wasn't the only reason I'm here, Sal. I need your expertise.
I haven't got any of that.
I was going to say, when you find it...
Yeah, exactly. When you find it, let me know yourself, if you could. Because, you know, 58 years, I'm still searching myself.
58? I thought you were older than that.
Cheeky.
Come on in, come and take a seat. How can I help?
Over the last few weeks, I've been in extreme pain. It's unbearable. It's literally, I'm swelling up. I'm still swelling up. A hair, but around here is so painful, and it just was. It feels like I want to stick a knife in to let all the pressure out.
How long has it been going on for?
Quite a while, but over the last couple of weeks, it's got a lot worse. And it's right here and right all around here. The pressure is just so painful.
OK. Does it disturb your sleep?
Yes, I'm up all night. I can't sleep. I'm just so drained. I'm just so tired. And then when the pain kind of dies down, it's like my stomach starts to pain as well. And then I go to the toilet, and all of a sudden, it's just like gushes of blood comes out.
What's this? This is a special machine I talk into, and then someone else listens to it and writes up letters for me. It's pretty good.
Dear colleagues, I'd be very grateful if you could see this man in the next few weeks about his problems, full stop.
I've tried to contact you on the phone several times, but unsuccessfully, full stop.
So that she is now a vegetarian, that this was entirely, sorry.
This was entirely, sorry. This was not, has tested her for full stop.
She's got a raised ALP and an abnormal gamma GT.
I'm writing to you for advice about whether I need to do anything. Many thanks for your help.
Yours sincerely.
Many thanks for seeing her, yours sincerely.
In the meantime, full stop, with thanks and best wishes, yours sincerely.
Blood is not there all the time. It's like my stomach swells up, and it just, when it gets really painful, then I got to go to the toilet, and then the blood just kind of gushes out at me, and then it's like my stomach kind of goes down.
OK.
And that happens like every couple of days.
OK. Now, you've had bleeding from the back passage before, And they examined you under...
Yeah, I've had a couple of operations. Well, I think 3 operations now on my bowels. But it's just too much. I just can't cope with it anymore.
So we come up to the couch. I'm just going to have a feel of your tummy. Would you be comfortable with me examining the back passage?
Yeah, fine.
So what I'm going to do is I'm just going to draw the curtain round. If you come and have a lie down here.
Yeah, I'm ready.
All right. Oh. Now, if any point this is uncomfortable, painful, and you want me to stop, just let me know, OK?
Yeah.
Any pain there?
Yeah, there's always pain there.
OK, that's all done. I'll leave you to get dressed. You let me know. Do you want me to give you a hand in any way?
No, I'll be fine. Thank you.
OK. You all right there?
Yeah, it just takes me out of breath.
There's a couple of things to check out here, Victoria, because it's obviously been going on for a couple of weeks. Now, as opposed to giving you pain relief, I'm actually stopping one of them, which is naproxen. We can book you in for blood tests, and I need a sample of urine. I'm going to have a chat with Dr. Graham about your history, but I think I'll probably be referring you to have a bowel check done. Is that OK?
Yeah.
OK.
All right, thank you.
That's all right. I'll give you a hand with the door. All right.
Yeah, thank you.
Take care. Thanks. Bye-bye.
Bye, thank you.
Could you just give me a short description while you're
I've got a rash come up all over my back, like my arms.
Yeah, that's no problem.
It's basically, I'm falling apart right now.
Yeah, we all.
Well, mine's going quite fast.
Yeah. What, your age?
Yeah.
Let's have a look.
How are you?
Not too good. It's just like got this mad sensation in my ears at the minute.
We've got an 111 report saying that you rang them. Was it yesterday?
It was like last night. Yeah, I went to A&E, but then they just said, I need to see a GP. They said there's nothing really that they could do to help me there.
OK. So did they have a good look in your ear?
I didn't feel like they did really look. She was just kind of just to see if I wasn't dead, kind of, if you know what I mean. Like that's like I do know I've had blocked eustachian tubes before, but now it's starting to hurt where that is, like, and it's like a burning like sensation, like someone's put an ear out, like a cigarette out in the middle of my ear canal.
OK.
And I just don't know what it is.
So when did you start having earache?
Maybe a couple of weeks ago. See, like right under there, like if I could drill in there, that's where the pain is exactly.
Don't.
I know, I'll try not to, like, sore, and I've got like this weird feeling of like rushing wind into my ear. It feels like my eardrums or something's about to just explode or something.
Is that there the whole time, or is that coming in? Sort of
that comes in like episodes, like every 2-3 minutes, like I just get it. Because obviously nothing's there, so it makes me feel like, whoa, is there something? Yeah, constantly makes me feel like that all the time, like.
Are you from Northern Ireland?
Yeah, I'm from Belfast.
Belfast. How long have you been in Bristol then?
Just about 1.5 years now.
What brought you over here then?
Oh, the music scene and stuff like that's like really good, like music.
Pretty cool, isn't it, in Bristol?
And that's why, because I make music.
What kind?
All sorts of stuff, like.
36.5.
Yeah.
Temperature's normal. And have you got headphones on a lot?
No, I don't actually use the headphones a lot, but I am exposed to loud music a lot. Like it's like electronic music, so it can't be like loud music.
Loud,
yeah.
OK. And I presume you don't wear any ear protection?
Not really, no.
It's definitely be worth something invested in if you're
definitely
exposed to a lot of loud music regularly, because otherwise you're going to permanently damage your hearing.
Yeah.
And, you know, by the time you're 50, you'll be going, what?
Yeah, that's not good. Like, I don't
to everyone and everything. Right, have a stand up for me a second. Let's have a look. So which ear is it that's painful?
Like both of them, really.
So any pain here?
Not immediately. It's
Any pain round here?
No, not that I can feel.
Okay, let's have a look in this one. Okay, so your eardrums actually look really healthy. It's definitely not sort of any nasty infection going on your ears. So I think it is probably your eustachian tubes again.
Yeah.
Okay, have you ever been to see the ENT specialist?
No.
Ear, nose and throat?
No, I have never been referred to them, no.
Okay. Your allocated GP is Dr. Barnard. I can have a chat with her about getting you to see ENT But the most important thing that you can do is to get some really good ear protection.
Yeah.
So in terms of treatment that you can do now, try some ibuprofen, 2 tablets of ibuprofen 3 times a day for just the next couple of days.
Yeah.
That will try and really reduce any inflammation down.
Right.
I'll have a chat with Dr. Barnard.
Right.
Have a look at some ear protection, ibuprofen, and come back if anything changes.
Cheers.
All right, take care.
No problem.
See you later.
Thank you. Cheers.
Between 4:30 and 5:30?
Yeah, I'll be in.
Is that okay? Home number that ends 308?
308.
Yeah, that's fine.
308, I like that's more Czech stuff. Were you an astronaut or something?
No.
Hello. Very efficient. Well, you trained him well, didn't you?
Come on in, come and take a seat. So I think, Ilaria, your English seemed fine last time, didn't it? Do you feel that we need to get an Italian interpreter? It's okay, isn't it?
Yeah,
really?
I want to try. I need to learn English.
Yeah, so all your blood tests are looking fine. And has this lump that you felt here...
I have a small, but not like last time when I came here.
I'll have another feel now, if that's okay. Is it all right if you just pop your jacket off there? So I'm just going to have a...
No, it's fine.
I mean, I felt all of this last time, and that whatever it was, I can't feel anything now.
Yeah.
Everything feels totally normal. Yeah, okay. Was there anything else you wanted to ask me today?
I have anxiety. I feel like panic. I'm too emotional. I feel depressed. I don't sleep well. I don't want to take any tablets.
And when did you come here from Italy?
I came in 2015.
Okay. Are you settled in a job here, or are you looking for a job?
I was working, but I look for a new job now. Tomorrow I got the appointment in job center.
Oh, good. Okay, so you're looking at the job side of things. And how many flatmates or housemates do you live with?
5.
5.
Yes.
Okay. And do you have a partner in your life at all or not?
No, I was in a relationship. I had a bad relationship. I don't trust, to be honest, I don't trust in love.
Okay. So you're carefree and single at the moment?
Yeah.
And no sort of, with you when you were younger or now, no risk of kind of self-harming?
No.
No, it's more anxiety.
Yeah.
I think you're right that we don't need tablets to help with that kind of thing unless it's something that's so persistent and you can't get out of bed and that you're not functioning.
I think too much. I always...
Yeah, but what might help is perhaps looking into ways of managing the anxiety better or improving the anxiety symptoms, okay?
Okay.
So there's a service here called Bristol Wellbeing Therapies. I'll just give you a leaflet about it. They can talk to you about anxiety, how to manage the symptoms better. Because we all have some traits, don't we? Some of us worry more, others are different. So if you know that and it can help you a little bit, it might be helpful. And how do you feel about that?
Good.
Yeah? And then you're working positively to that. You're going to the job centre tomorrow.
Yeah.
Your blood tests are fine, not worried about your physical health. Okay. And
I always check up about my, a little bit hypochondriac.
Okay, about the health side
because
of
when
things.
my mama, she had cancer, when my granddad daddy had cancer, I feel more apprehensive.
Yes, worried
So I want to check everything, it's all right.
So I think physically not to worry. If there's any symptoms, you can come back and talk to me or talk to us. Okay.
Okay, thank you very much.
That's all
Lovely
right.
to speak with you. I like.
No problem. Pleasure. Nice to see you.
Thank you very much.
That's all right. Nice to see you. Take care. Good luck with all the job things tomorrow.
Thank you. Thank you. Lovely. Have a nice day.
Bye-bye.
I still haven't had that chest X-ray.
Right, okay. Hi. Hello. Are you partner? Yes.
Not partner.
No,
Right.
just friend.
Just a nosy friend.
Right, are you okay? Are you happy for her to be in here?
Yeah.
Right.
Yeah, she just wants to tell you about the pain I had last night. I think it was angina attack. And that's what the GT spray's for, isn't it? So I sweated, right, okay? And it was like a ball in my chest, right, okay? And I took the GT spray.
Yeah.
2 lots and it went.
So, so you've had a heart attack about 2 years ago now, isn't it? So generally, do you get angina pains?
I do get pain,
Yeah.
yeah.
And when do you tend to get those pains?
Any time I could be.
So how often are you getting them?
You're getting them a lot, aren't you?
How much is a lot?
You have them...
Yeah, but I don't know whether it's chest infection, because I got a cough at the moment, and I'm bringing up green
Okay,
phlegm.
we'll assess that in a second.
Yeah.
So you're getting pains then?
Yeah,
So how often are you getting these pains?
Every-
And what are the pains like?
I don't know, it's like a tightness in the chest.
Yeah.
And then I sweat.
Yeah.
And then I take the angina spray and it goes. You know what I mean?
Okay, so it sounds like angina then, doesn't it?
Yeah.
If it goes with the spray, I think that's the most
that's right. That's what the
likely.
surgeons told me at the hospital.
Yeah. Have you been getting them most days since the heart attack?
Yeah, not every day, on and off.
Right.
I get good days, I get bad days.
Yeah. In terms of your angina, I'm a bit concerned about that. Almost daily pains is very frequent, isn't it?
Yeah.
Hello there. That's a good T-shirt.
Thank you. Primark is the way forward, or Primark, however you say it.
Like your T-shirt. It's
Oh,
nice
thank
and
you.
bright, but
It is
sort of
bright.
dark at the same time,
Yeah,
isn't it?
yeah, a bit of sunshine.
Yeah. That looks like a good thick jacket.
Arm inside out.
Nice shirt. I like that.
I haven't seen you before, have I? So you remembered somebody as smartly dressed as you?
I realised when I left the house that I was wearing all blue, and I was a bit worried that it looks like a vote Conservative.
Now, in terms of your chest,
Yeah.
you said you're coughing up green muck.
Yeah.
How long has that been for?
Last few days, well, because I stopped smoking again. I've been about 20 days now. I haven't had a cigarette for, you know what I mean? So.
Right, let's see what your blood pressure is.
Right.
Okay. No, so don't. Don't talk. Okay, it's too high. All right. Let me have a little listen to your chest. Can I pull this up at the back?
Yeah.
Okay. Deep breaths. Okay, a bit wheezy, not too bad. Okay, let's get a chest X-ray. I'll request it again, but go up this time.
I'll go tomorrow.
You're going to nag him. Excellent. Okay, now we need to add in something for your blood pressure.
Oh, is it all right?
So you're on amlodipine.
Mm-hmm.
So we need to add in ramipril. So go for a chest X-ray tomorrow.
Yeah.
Start this new tablet, 1 a day for a week, then 2 a day. Okay?
Cool, yeah.
Book an appointment with the nurses for a COPD review as well.
Yeah.
Okay?
Okay, yeah, cool.
And then we'll try and start
Just a
to
quick-
sort everything out.
Remember when, before I never had no movement in my foot, so I bought one of these circulation boosters, right, okay? And
No idea what that is.
No?
So in
It's
which
a thing
case
you
I
sit
don't.
on, and
Yeah.
look, I can move my foot, and I moved it for 2 years.
Brilliant.
Oh, yeah, I bet you're excited about that anyway. Yeah, time to go, sharp exit, quick over.
Right, so book an appointment for 2 weeks, yeah?
Cool, all right, thank you.
Okay, bye-bye. Bye-bye.
Hello, can I help?
Yes, please. I think I've got an appointment for the treatment room.
And the name?
Di.
No, you've got an appointment on Friday at 9 o'clock. You're diabetic with your Friday, my lovely, yeah. All right.
It's all right. Well, I'd written it on the calendar as Monday.
Right.
Had a
A
text
text, no,
reminder.
we usually text the day before, so hopefully you'll get the text Thursday. Yes, Friday at 9.
Thank you.
All right, no problem. We'll see you then. Take care, bye-bye.
Gaynor Pocock, please. All right?
Yeah. Not really.
Well, you wouldn't be here. It's one of those stupid questions, isn't it? Those doctors. I've probably been saying it for the last 20 years.
No, fine, thanks.
OK, I'm Dr. Bolam.
Yep.
what can we do for you?
Well, going back last year, I had a growth on my leg. And I feel, or I think, I got another one coming.
So last year, did you have it removed?
Yeah, I did.
And what was it?
Some sort of carcinoma, was it?
Well, it was a cancer, was it?
I think so, yeah.
OK, shall I have a little look,
Yes.
seeing as do you think it's the same thing, do you?
Well, I can remember this is how it started.
A squamous cell cancer. OK, let's have a look. So the previous one was here.
It's near enough sort of opposite, really.
Right, they had quite a wide excision, didn't they?
Yeah.
Yeah, OK. So tell me about this then. How long's that been going on?
This one's about a month.
What's it doing? Is it bleeding or anything?
No, not bleeding, but I just know it's there.
You know it's there.
And it's raised more in the last, that's why I've come.
OK, it
started to raise, that's how the other one started.
OK, so it's pretty much the same as the other one, is it?
Yeah.
OK, all right. Yeah, and do you protect yourself from the sun?
Yeah.
OK, all right, I'll refer you back. Was it similar size, the one that was removed?
That's how it started, but by the time I got there, it was like about this, about this big.
OK.
And they didn't ask me for a follow-up or anything that told me. They just said, if you get anything, just go straight back and get straight back up here.
I'll do the urgent referral, all right, because we like to get rid of those. If it's the same thing, we do like to get rid of those quickly, OK? Yeah. So that means you will get an appointment in the next 14 days. And you understand that, obviously, we have to say this because I have to tick a box. You understand that it's a potential squamous cell cancer again. You understand that?
Yeah.
OK, all right, so this just tells you about the urgent referral scheme and tells you what to do if you don't hear from anybody in a few days' time. All right?
Yeah.
Give that number a ring. OK?
Yeah.
Is that all right?
Yeah, that's fine.
OK?
That's lovely.
Right.
Yeah. I'm just glad I come and got it rolling.
Absolutely, yeah, absolutely. OK.
Yeah, thanks
all
very
right,
much then.
Okay.
Thank you.
No worries. Bye-bye.
Okay, Jackie, can we grab a seat? Are you in trouble?
What?
Are you in trouble?
No, it's only two.
It's to do with your back again, I think.
No, this is to do with the cancer bit.
Oh, right, OK.
My brother's had gene therapy.
OK.
So they've sent letters out to the family just so I can get an appointment. They said they'd send it to you.
Right, OK. Let me have a look at this, because this is not what I thought you were coming back about your back.
No, touch wood, it's fine.
Oh, good,
really,
oh, good. All right.
I can't be more happy with it. It's like I'm young again.
OK, and you have mentioned the business with cancer before to me,
Yes,
haven't you?
yes.
Family history of bowel cancer. This is your brother, you say?
Yes, and my mum's had it as well.
I presume you've come here with the letter. You'd like to have this.
I certainly would, yeah, definitely.
Yeah, OK. Genetic testing is used to find out if someone is carrying a gene that might predispose to a particular condition. People are counselled before any form of genetic test is carried out. It is very important that people understand the potential benefits of testing, such as early diagnosis and possibly even cure of a condition that otherwise would be very serious. But they also need to realise that there are risks associated with testing, particularly the anxiety as you go through the test and also if something is found of a serious nature. Have you thought through all the implications of what it would mean if it was positive? Or
Yeah.
Tell me what you would do if it was positive.
Well, just see what the doctors say, really. It's down to them, isn't it? I'm not sort of one of those who gets fazed with anything.
Okay.
It's just...
OK.
Because I've had a scan with the camera up there, and that was all clear.
OK. So, but if it was positive, I think there'll be three implications. One, I think, is that they would want to continue to give you scopes quite frequently.
That's fine.
Yeah, OK. Secondly, I suppose, in theory, there might be an implication in terms of sort of insurance in the future. So, you know, if they knew that you were at an increased risk of a particular condition, that the insurance companies might take a view on it. The third thing is, I suppose, there would be implications for children as well. You've got kids?
Yes, I've got two, yes.
Yeah, so, I mean, if you had a positive test...
Yeah, that's my brother explained a lot of this as well.
Then they would have the decision to make that you've had to make, and you know, that would be putting that on...
But I think I'd rather
down to them, and so they
stay alive a little longer.
Yeah.
Then sort of say, no, forget it. Like,
we'd all like to stay alive a bit longer.
Yeah, definitely.
OK. All right, so I'll make a referral to the genetics service. OK, and you'll get the letter through the post.
Excellent. Thank you very much.
All right, OK.
Thanks.
Cheers.
with somebody. Can you hold? Carol?
Let's wait.
Let's wait. There you go, Carol. Take care. Bye. Hello. Sorry, my lovely. Can you hear everything? I put it on hold. I put it on hold. When I put it on hold the other day, it played music for me. There's obviously something wrong with this blooming phone. Yes.
So, what's happening today?
You tell me.
I saw you about 3 or 4 weeks ago, yeah?
Yeah.
And the main problem is your knee at the moment.
It's my hands as well.
And your hands as well. You were trying out a little bit of having some morphine.
Yeah, it helps, but it don't take it away.
No. And apart from that, what are you taking painkiller-wise?
I've got these patches on.
Yes.
Naproxen.
Yeah.
And then,
And paracetamol.
yeah, and the other one's on a night,
Amitriptyline.
you're rattling soon.
Yeah, you are on quite a lot.
I got it in this side of the hip as well.
Yeah.
And my shoulder.
Yeah.
Because I think you seen my missus last week.
Yes.
And I tried to do everything for her, but I just can't do it.
Yeah.
In the mornings, it's like, can't move them.
Yeah. Which bits of your hands are affected? Do you want to just show me?
Yeah, it's all in the knuckles.
Right, in these ones here?
Yeah,
Okay.
and it's the same with this one. I think
Okay.
it's a bit swollen this morning.
Yeah. If I press, say, on that joint there, does that hurt?
Yeah, a little bit, yeah.
It does. And this one here?
Yeah, they're tender.
Yeah. Okay. And did anybody do any blood tests to see if you had an inflammatory arthritis, something like rheumatoid or
He said it was osteo.
osteo?
Yeah.
Yeah. So I am wondering whether we should maybe repeat those bloods and maybe even get you seen by a rheumatologist just to be sure that we're not missing
Yeah.
something.
Anything that'll
Yeah.
get rid of it. Or
Yeah.
Ease it off. Or...
And do you think you need a bit more help at home with your wife?
I've got a granddaughter, but she's at college.
Yes.
Because Heather, when she stands up and sits down, that's it. She can't do nothing.
No.
And I can't get in the bath now because of my knees.
Yes.
So we've put in for a walk-in bath or a
Yeah.
shower or something.
Good. That sounds like a good idea.
I haven't had a bath for, I can't remember.
Yeah.
I got in there one day, I couldn't get out.
Right. Okay.
So I just have sort of strip washes now.
Yes. And how are you feeling about your caring responsibility? Is it getting you down a bit, do you think?
Yeah, because I worried about Heather, because she nearly died last year. Yeah, I just...
So I think we ought to put you on our carer register, I think, shouldn't we? Yeah, because you definitely are her carer. If you weren't able to do what you are doing, then somebody else would need to. And it may be that it is time to think about whether you need some more help at home. So the way to get it in Bristol is through an organisation called Care Direct.
Yeah.
And we have a carer coordinator at the practice called Heather. She can contact you and see if there's anything else we can help with. Would that be all right?
Yeah, that'd be great.
Yeah. And I'd like to book you in for another set of blood. Is that all right?
Yeah.
Okay.
Yeah, well... Oh. Falling apart, works on me
All
like
right.
and ends up dead.
I'll see you again,
Right,
OK?
lovely. Yeah, thanks.
Bye-bye.
Bye.
Stephen McDade. Hi, come and have a seat. What can I help you with?
My partner required that I came.
Yeah.
We were out on Saturday.
Yes.
And Foot Park, and I fainted.
Right.
And she's a nurse.
Yes.
And she was pretty much after that, taking my
Yeah.
pulse the whole day, and she kept telling me I had an irregular heartbeat.
Right. So take me back. Exactly what happened with the faint?
To be honest, I hadn't drank anything all day.
Yes.
And we were on our 5th ride.
Yeah.
And I came off and I could hardly walk.
Yes.
And I just fainted.
And did you start? So you started feeling unwell.
Yeah.
Did your vision change at all?
Yes.
What was it doing?
Kind of blurry.
And then you just
Fainted.
fainted. And do you know how long for?
A few minutes, I think.
And then other people were around you, were
Yes,
they?
yeah.
Did they notice you shaking or anything like that?
My partner did, yeah. She said that I was shaking and I just went to the floor.
OK, before you went to the floor?
Yes.
Yeah, but you didn't think it looked like a
No.
a seizure?
No.
No. And then when you came round, how did you feel?
Very shaky, sweaty.
Yeah.
And eventually, after a while, I was actually sick as well.
Okay.
I found out Saturday that there is history of heart problems, and like my dad's got low blood pressure, my mum's got high blood pressure,
Right.
and my granddad died of a heart attack.
And you look much better.
Yeah,
let's face it.
I do.
Yeah, your nails are done, your makeup's
Yeah.
done. All right.
Yeah.
That's a good noise, isn't it? Thank you for wearing shorts. Nice, easy knee examination.
I just want to check if there is Dr. Graham running late. She said, I'm not even going to bother to check. She never runs late.
That's not actually entirely true. So if you find you feel a bit weird on it, then you just have to take it off.
There you are. If I go weird, you know why.
Any weirder?
Oh, thanks, Doc. Yeah.
OK, boys, it's time to go. Sorry.
He's got a rash on his back and it's not seeming to go down, so I just thought I should just get it checked out.
Oh, yeah.
It's really only on his back, like there's an odd one.
On the front.
You've got one or two, haven't
Yeah.
you? OK, you can put your T-shirt back down and have a seat now. How long's it been there?
Well, probably since like Saturday evening. around
Maybe,
there.
yeah.
So not very long at all.
Because I went to the woods on Thursday with cubs, and I came back and I felt fine. And then on Saturday, my back started itching, and they had a look and they saw a rash, and then on Sunday it got a bit bigger, hadn't it?
And is it itchy?
Yeah.
It is.
When sometimes I can just feel it itching, I try not to itch it, but
Very good.
sometimes it's just itching so much that I just can't resist it.
Fair enough, that's very honest. And do you feel ill in any way?
No, I don't really
No.
feel ill, it just...
OK, well, I think what we'll do is we'll just take your temperature and your pulse, OK? See what that shows. I don't think it's anything too worrying, OK?
OK.
That's totally normal. Let's take your pulse. Just have a wrist. That one will do. That's fine. OK, and have you looked it up and thought about what it might be?
I gave an Imperaton to take the itching away, and then I just did look up chickenpox.
Yeah.
Because he hasn't had that.
Right.
Piriton, it helped a little bit.
Well, it's great stuff for stopping itch of any type, OK? So I think that it is possible that something in the wood irritated your back, OK? And that you're a little bit allergic to it, and so you've got this rash. It looks a little bit like nettle sting, and it's behaving a bit like that. So you're not ill in yourself, but it is a bit itchy, and that's about it, really. It's there.
I did see some stinging nettles.
I'm not saying that it's caused by stinging nettles, I'm just saying it's a bit like a stinging nettle rash. And it's probably due to an allergy that isn't anything to do with stinging nettles, it's just something that was in the wood. You're doing the right thing by giving the Piriton, which is giving him some relief from the itch.
Yeah.
And that's probably all that needs to happen.
Carry on with the Piriton then?
Yeah.
OK.
Yeah. Is that all
Brilliant.
right? Yeah.
Thank you.
Good. OK.
All right, thanks.
Thank you Great.
Very much. OK.
Thank you.
Can I have a little listen to your heart if you lift your top up for me? Okay. Just check your pulse. Just follow my finger with your eyes. Not seeing double at any point. And you felt completely well since Saturday?
Yeah.
Yeah, OK. And do you drive at all?
Yes, I do.
Yeah. So I need to look up the DVLA guidance and what we need to do.
Am I going to lose my licence?
I don't think you're going to lose it, but you might be temporarily not able to drive while we do some tests.
OK.
It sounds very much just like a simple faint. It's just now this kind of thing about your partner reporting that you had this irregular pulse. That's the kind of complicating factor. Though I think you must not drive for the time being until we've done the tests. Does that sound annoying?
Yeah.
Yes. OK, so tests will mean some blood tests, an ECG, and then what you really need is a monitor you wear for kind of 24 hours that will pick up any irregular heart rhythms and things. So till we've got all those results back, no driving for the time being.
I can drive home?
Would be no. You'd have to get someone to come and pick your car up for you.
OK. Give my dad a call, because we only live up the road anyway, so...
That's fine. OK, then, and we'll take him in there. And if you have any more episodes, we need to know about it.
OK.
OK.
No problem. Thank you.
Bye.
Oh, no, look at her.
Not from me, it's from the uncle.
Can't got an uncle.
Bring you my wee.
Oh, thank you.
I love it when patients bring me wee.
OK. Why have you brought me wee?
I had a urine infection. I get them semi-regularly, so I know what the symptoms are. I got it Sunday mid-afternoon, actually, probably.
Yeah, that's very specific.
So I basically spent the rest of the afternoon backwards and forwards from the bedroom and bathroom.
Urgency?
Yeah, I need to go right now or I'm going to wet myself.
Yeah. Pain?
The first bit of wee is fine.
Yeah.
And then it's the very last, dribble, stings, and then my body feels like it's squeezing a sponge, got the very last bit out.
OK.
And then I release, and then I'm like,
OK.
Isn't this feeling amazing for about a minute? And then I'm like, oh my God, really need to go for a wee.
Go again. OK. Any tummy pain at any point?
I've had some tummy pain kind of here.
Anything high up round your back?
No.
Any blood at all that you've seen?
When I wiped, it was slightly pink.
OK. OK, yeah, so you've got a urine infection, definitely. So we'll give you some antibiotics.
I'm allergic to penicillin.
Won't give you that. But no other allergies apart from...
plasters, wool. I'm allergic to a lot of...
Wool?
Wool makes me come up in a rash. Some shampoos make me
It's the ginger gene.
It is.
I'm a closet ginger as well, and I had a bit of a reaction to, what was it, fentanyl after an anaesthetic, and the anaesthetist said, oh, it's because you're fair and ginger. Apparently it's a really common thing to have sensitivities. The most common cause of urine infections is sex. Yeah, so always empty your bladder after sex, and then just the obvious other things like wiping front to back, which I don't know who doesn't, so... And just making sure that you're drinking plenty as well. Just have a quick feel of your tummy. Just have a lie down on the bed for me. Right, just check that you've not got any nasty pain anywhere.
It does feel quite uncomfortable.
There. OK,
Yeah.
that's all right.
Yeah, that's...
There, OK. That's all right. OK, all right, so just lower down. This is over your bladder, so that's fine. Right, I just need to get a signature for this.
Yeah.
If you have a seat back in the waiting room, and I'll bring this out to you when I've done it in a minute.
That's wonderful. Thank
All
you.
right.
Bye.
See you in a sec.
Do you feel any better now?
Yes, I do feel
a bit more relieved.
Nice to see you both.
Thank you.
Bye now.
Bye, Carla. Nice weekend.
See you next week.
I'll see you next time.
Thanks for your patience.
That's what I am, a patient.
Yes. OK, bye-bye then. Bye, Dumbo.